Hello everyone, welcome to our YouTube channel Osmania Docs. Are you planning to take Osmania Medical College NEET PG 2025 counseling? Let me give you a real inside story about the residency life here. Myself Anil, and today we have our senior Dr.Sai Kumar sir, third year resident, Department of Imaging and Radiology, Osmania Medical College.
Hello everyone, I am Dr. Sai Kumar, final year resident in Osmania Hospital, Radiology Department.
Sir, when did you choose radiology as your dream branch? Whether in the internship or after completion of NEET PG exam?
It's a good question. Actually, during clinical posting, radiology plays a central role in diagnosis and treatment planning and then follow-up and almost in each and every department.
Yes, sir. When we are in internship, most of the sent to collect radiology report and USG report, CT report. Yeah, actually, that motivated you to choose us.
Yeah, even I enjoy the pattern recognition and the problem solving type of thing and collating with the lab reports and arriving at diagnosis. So I like this kind of stuff and the intellectual challenge here. Intellectual challenge here, it's a good thing. And moreover, next thing, the work-life balance. Good work-life balance will be there with the personal well-being and as well as the career growth.
Okay.
And also, there's lots of flexibility in timings also. Maybe you may not get in the residency life, but after residency, down the line, after 3 years post residency, you have the luxury to choose your timings.
Okay.
So
if you want to earn more, we have to work more.
Yeah, work more. And no branch has this kind of thing. And you can leave your job itself in the hospital. You don't need to carry it to the home and just worry what is going on. So this kind of luxury, very few branches it has this. So and even the people guys who feels that there's no hands-on and there's no patient interaction. There's another branch like interventional radiology, which is very close to surgical cells and also having a good patient interaction. So and good job satisfaction mainly. So I feel and overall it matches my interests. So everything for my career goals and everything. So
sir, why did you choose a radiology in Osmania when compared to other institutes all over the Telangana and other central institutes?
Yeah, because one thing, Osmania has a huge patient load with allied hospitals and wide spectrum of cases. We get to see both rare and the common cases here. With the rare case and everything, we can do that research. Who are interested in doing research and everything and publications, they can do this thing. And one more thing, the good reputation of the department. Here, the faculty is very encouraging and very experienced faculty with supportive and friendly the seniors.
Yes, sir.
So that is also a good part and good academics even. Good academics, and I don't think so academics matter much in generation because there's a lot of content in the YouTube and there are lots of apps are coming apps are coming. So that is the maybe many are starting their taking the online apps from the first year in. So academics is not that much important. It's okay. Academics are good even. It's not the best one. It's okay. It's par with the things. But the modalities are there. All the modalities are there. We are having every modality is there. Well equipped Osmania Hospital with a huge patient load. So that is the most important thing, and that Osmania satisfies that thing. So and one more thing, the Osmania brand.
Yeah, yes, sir.
So wherever you go,
in corporate hospitals, if you say from Osmania, they definitely you take and they will.
Yeah, in fact, man, if you are going to other country, even you are recognized. If you are going to Dubai, you are given a superiority there.
Yeah, as you said, it is in Dubai, and as many of the USML residents are from Osmania only itself, around 1500 when all over India. Yes, it is high from Osmania.
Osmanians are everywhere. They are everywhere over the universe.
Yes, sir. Sir, how many PGs are there in radiology in Osmania?
So there are 16 PGs intake per year. Per year.
Okay.
And 8 are from state quota and 8 are from all India quota.
Okay.
And
how many senior residents are there, sir?
Senior resident, it will be around 9. Around 9. Last year it was 4, and before year it was 9. It keeps on changing. Depends.
Sir, how department works? Whether in which, for example, in first year what works will be in second year what works, in third year what works. Could you explain briefly about that?
Actually, Osmania has allied hospitals. Because you are also from Osmania. Around 8 allied hospitals are there. Under 6 allied hospitals, we are having radiology department. So we are posted everywhere. So we are rotated to these allied hospitals every month.
Okay.
So every month. So from first year onwards, we are we are having peripherals, more or less like.
Okay.
So from first and it was like home departments only, that allied hospitals.
Okay.
So that allied hospitals, namely, we have 3 maternity hospitals, Sultan Bazar, Petlabuz and Nilofer. Nilofer will having a along with the maternity imaging, it is also having pediatric imaging. And MNJ hospitals having for onco radiology, and chest and TB hospital for pulmonary imaging, specially for, and ENT for ENT cases. So in this manner, we are having almost every exposure of subspecialty. Every exposure of subspecialty is there, and when in Osmania you have that every kind of super specialty department, and general medicine, surgery, and ortho, and anesthesia, and these kind of dermatology, these kind of departments in Osmania General. So almost every kind of subspecialty are exposed in radiology. So very few hospitals in South India or even India having these kind of exposures and everything.
Exposure with along with this much patient load.
This much patient load. So the patient load, the modalities, everywhere in every hospital. If I want equipment to tell what is the equipment, you have 3.
When coming to equipment, how advanced equipments are there in Osmania, sir?
Yeah, we have equipment, but not that advanced. But we are, well, it's a good enough equipment to become a proper radiologist and to come out as a proper radiologist. So coming to, we have 3 maternity hospitals. I told where we have multiple ultrasounds. Where we are getting for fetal ultrasounds will be done, and OBG cases will be done there. And with Nilofer is also having 16+ CT there, yes, along with multiple ultrasounds, around 4 to 5 ultrasounds with X-ray facility and with CT, 16+ CT. And MNJ is having the multiple ultrasounds, 4 to 5 ultrasounds there, and there are 120 CT and 1.5 MRI and digital mammography, and your digital X-ray, and you have even having DSA in the MNJ hospital. So it's a it's a complete hospital. Even that's enough to become.
We can't find in government hospital all this kind of.
All this kind of.
Other medical colleges all over Telangana, Andhra Pradesh.
It's like a complete hospital.
Yes.
And coming to chest and TB hospital, we are having 16+ CT there, and we have 2 ultrasounds there, and ENT maybe we are having 16+ CT there itself, and maybe one ultrasound, I think. No, I don't know. And so it's kind of, Osmania General Hospital, you have multiple ultrasounds. We have 5 to 6 ultrasounds with 2 CTs. One is 16+ CT and one is 128 CT. That 128 still it is under repair. It will be solved soon, of course. And 1.5 Tesla, which is a very high resolution, the new one.
Yeah, recently one MRI also imported from Switzerland, cost around 30.
30.
It's advanced only, no, sir?
Yeah, it's advanced one. We can see it's good enough to learn for a radiology resident, to learn everything, to become what are the good radiologist.
Good radiologist.
It's enough. So overall, I can say it's a Osmania. There is nothing less. So one thing I can say, Osmania doesn't have the DSA. DSA, it doesn't have digital fluoroscopy. It doesn't have, but that facility, that DSA thing, you are having an MNJ. So it is only in budding phase, but it will grow in future, because MNJ you get to see many cases and many. So obviously the role will increase. It only expands in the future. There's no fluoroscopy in the Osmania General Hospital.
Sir,
so
how departments works? How radiology department works at Osmania? Could you give a brief introduction about that?
Yeah, actually, the department, there will be OP. There will be actually the timings for OP and IP. There are 9 to 2.
Okay.
Then after 2. There's some half an hour break for the lunch, and then 2:30 to 4 o'clock we are having regular seminars. Regular seminars will be there, and weekly faculty class, and monthly there will be exam. So monthly like slip test will be there, or at least 2 monthly they'll put either for the first year or second year or the final year. It will be like that, and there will be interdepartmental meets in the Osmania, where the 2 departments will meet and get solve the case together. And so there are even a lot of academics are going on in Osmania, even in the department itself and in hospital itself. So you don't, where other hospital, I don't know, but it's good academics here.
Yes.
Even I can say. So everything is good. Modalities are good, patient load is good, and that, so there's no less.
Sir, how many duties per week we will get in Osmania?
We are getting now the 16 are there per duty. 2 are posted, and 2 first years, and 1 second year, and 1 final year, and there's a senior resident there, which will supervise the things. So you will get hardly 4 to 5 duties per month.
4 to 5 duties per month. Is there any post duty off, as many of our audience are commenting about that?
Actually, no post duty off, but the duty is not that hectic.
Okay.
It is a manageable duty. You will get the shift, 4 to 5 hours shift you will get.
Okay.
And I don't think so you need the post duty. It's a huge loss for you. Even sometimes the 3 year radiology residency is not enough because radiology is a huge subject, the vast subject.
Yes, sir.
So you need to utilize this. Post duty of it's a disadvantage, I feel, rather than in radiology. I mean, mainly in other departments who are having hectic duties, maybe they can take, but radiology I don't think so. And it's not that hectic duty. It's a good number of cases. We are in OP. We are almost doing daily 200-250 cases. Osmania General Hospital, I'm saying 200-250 hospital ultrasound cases and 100 plain CTs and 20 CCTs and 20 MRIs.
Okay.
So, and even the 300 X-rays will be done. So even the barium studies are done. 20 barium studies, around 20 like barium studies are done. So every kind of exposure is there. So come and that's it.
Sir, as many of feel radiology has no patient exposure and no hands-on, how you will feel, sir?
Yeah, actually, as a fresher, suppose someone is taking a radiology resident, very new, it's very little difficult for the first 6 months to accustom to the situations there. So reading, there will be no patient interaction, and of course there's no patient interaction, and identifying the gray patterns. Many of them don't understand.
Yeah, initially because we don't have much
exposure. Even
exposure to radiology.
Yeah, radiology. Even UG life also you're not exposed to the radiology stuff. So it's bit difficult to accustom to the things and to get hang of it.
Okay.
So
actually, how many months it takes to accommodate to radiology, sir? In and around.
Personally, I took almost 6 to 8 months.
Okay.
More than 6 to 8 months.
Okay.
To get that hang of it, and so it takes some time. But there's a phase. Where the graph goes very exponentially, grows exponentially. So there's a initially when you grind out, it will be very plateau.
Yes.
So once you are able to understand the things, once you are making a diagnosis with identifying the patterns of gray, pattern recognition, and then correlating clinically with the lab reports, that is where the thrill starts. Once you make the diagnosis of your own, that is where the thrill starts. Then that is where the passion begins. And once you get into that zone, there's no stepping back, and you always go exponentially. And you feel that you can enjoy the luxury. This is a branch where you can pursue the passions also. In fact,
yes, sir.
Because no other branch has that luxury.
Yes, sir.
So once you get that knowledge and everything, you are able to diagnose it. You feel that you get the job satisfaction, as well as you get a free time. And
sir,
everything.
as many of them says there is no hands-on. Could you suggest some other? What are the procedures can be done in radiology?
Because the many feel that there is no hands-on. Radiologist only sees the gray images and always being themselves.
Yes, sir.
There will be no patient interaction. So these are the myths going on in the radiology. There is a patient interaction when you're doing ultrasound, of course. It's a pro and it's a con, patient interaction.
Yeah,
some persons who don't want to talk, it's a pro, and some persons who wants to talk, it's a con. So one thing I can say, one advice I want to say, that the persons who are very interactive, and very want to become a good clinician and want to have the gratitude from the patient, radiology is not a branch for you. That is I can say. One thing I can say. So if you want that gratitude, you can't. So your question is procedures.
Yeah.
So that procedures may you have hands-on also in this radiology. In the general radiology, I'm saying, not the interventional. General radiology, you can do the biopsies and FNAs by CT guided and ultrasound guided, and you can do the amniocentesis and
powder synthesis.
We can do the PTBDs, pictorial catheterizations. So etc. Many are there. You can do. So there's nothing like that.
There is no need to worry about hands-on and patient exposure.
Yeah, having said that, but you want to develop it. You want to develop that skill. Once you get that skill, even you feel thrilled. So if you are more close to the surgical branch, you are having the interventional radiology practice, which is the next upcoming branch, emerging branch in the future. So there's a big role to play interventional radiology in the future, I feel, because because nowadays, the minimally invasive surgeries are more common, and people want to get it done without any complications. Because interventional radiology will take the radiation, but the patient is saved with the good minimally invasive surgery with less complications. So that is developed. Trend will come very soon. It won't take much time, I think.
Sir, other thing is, what is the difference between DNB and MD radiology? Because as many of them are getting doubt about that.
There's no difference between MD and DNB.
Okay.
There's no discrimination, equal job opportunity, equal pay, and equal salary, everything everywhere. So there's no discrimination everywhere. But only thing that you can't join in very less opportunity. You won't be prioritized for the medical colleges, government medical colleges. Other than that, even some DNBs are good.
Is it okay to do radiology at a DNB institutes?
Yeah, you can do.
Whether it's highly highly acceptable or somewhat low when compared to
there's no difference,
MD.
man. There is no difference between MD and DNB. Only thing that you can't join in government medical college, but there's equal priority for MD and DNB in corporate setups. Even some corporate setup will prioritize the DNB.
Okay.
So because they have good knowledge and they are doing in a private colleges with a high equipment. So there's no difference. There's no much difference. And
we can also do radiology in the private institutes also, sir. Is there any disadvantages?
Yeah, one thing that there's no much hands-on. You are not able to report solely.
Okay.
Where are government hospitals? You are yes, you are left alone and someone will be supervising, of course, but you are allowed to report solely. But whereas in private, you are not allowed to report. You are only you can see the reports. You can only screen that reports. But there's no much hands-on, I can say. Very few hospitals having that hands-on. Ultrasound you can do, but see cross-sectional imaging is a bit problem there.
Okay.
Of course, and one more MD, DNB, what I want to say. Yeah, there's no much difference. There's no discrimination much.
Okay. Sir, and other thing is, what are the super specialty scopes in radiology?
Yeah, super specialty. Actually, the interventional radiology, which is by writing the NEET SS, we can go through the DM interventional radiology or neuro radiology. So it's a 3-year course. It's a good branch. It's a new emerging and dynamic branch in the future. I think, and even we have many fellowships here. Many fellowships with growing demand in that field, like MSK radiology and fetal medicine and neuro. Even fellowship we can do in interventional radiology and so cardiac radiology. So there's nothing.
Sir, one thing I want to ask is, as many super specialties are growing and they are doing fellowships in imaging, will all this affect interventional radiologist as further career?
Yeah, one thing I can say, one of the con to radiology is many of the branches are breaching it. Many of the super specialties are
trying to breach and overlap the radiology.
So that is where the con for the interventional radiologist, because many of the procedures that are overlapped between them, even especially in cardiac radiology and neuro radiology, where the many procedures are overlapped with the interventional radiology and the neurology and cardiology. So that is one con.
You can say
this, but there are many procedures which are very solely
done by the
interventional radiologist. Okay. So there is no need to fear even.
And the main thing I want to ask is, as many of them is doubting, will AA will replace radiology? What do you say about that, sir?
Yeah, it's a lot of hype around this question. It's an informed bias to the radiologist.
Yes, sir.
And it's a skewed bias and it's layman bias to the non-medicos.
Okay.
No, AI won't replace radiology. We'll see how radiology, AI came everywhere. Not only why in radiology why people are stressing more in radiology.
One thing I want to say is already X-ray reporting is done by AI in AIMS also. AIMS.
Yeah, X-ray, maybe it is reporting X-ray and maybe reporting CT or MRI. We don't know. But one thing I can say, so I show that AI won't replace radiology.
Okay.
So one thing, and the people who will use the radiologist who will use AI will have that advantage. That I can say.
Okay.
That is for sure.
If not replace, it will add.
It will add. I will see the benefit. So now many techniques are coming, like AI assisted analysis.
Yeah.
AI act as assistant.
Okay.
In detection, quantification, and segmentation.
Okay.
So when just in the past decade, there are few X-rays are done, few CTs are done. So now many CTs are done, many X-rays are done. So we want someone to triage it.
Okay.
So many things are there, many CTs, many X-rays are done. Then there will be a chance of human diagnostic error.
Yeah.
So that is where the AI plays a role. AI helps in triaging, and there's a computer aided detection. In X-rays we can't detect some of the very
Minor.
small solute nodules that it can detected by the computer aided detection. And also the new thing is coming like radiogenomics, where the AI analyze the texture and segment the lesion and helps in the gene locate the gene mutation.
Okay.
So in this way it also working in genomics, even radiogenomics, like it's a branch. So even the AI is making the radiology more interesting and more simpler, and it will make the radiologist more efficient and more precise and more acute with faster reporting and everything. So that's it. And even but even so, if, nobody want the robot to do the to get the
anyways if anything happens, definitely it has to answered by a doctor only.
Answer. So even the AI is reporting everything, but final interpretation with final clinical correlation and judgment and responsibility should be taken by someone. That is not none other than but the radiologist. So now radiologist should take that kind of responsibility and judge that clinical correlation, and they're coming to the signing of the reports. So nobody want to get the report from robo. So I don't think it will replace. And meanwhile, you can use. Meanwhile, if they are reporting, then what we can do? That is the main question. Maybe we can use your super brain, and you can use your knowledge of medicine for the last experience for the last decade you have gained for some other work, some other things to evolve. To look to evolve the radiology in more aspects, to see the images beyond seeing images, to evolve the radiologist role beyond seeing images. So in this manner, AI will only help, only make the radiologist more efficient and make the work simpler and fast and with very accuracy. But it won't replace radiology. The last piece I can say that AI, the persons who are using AI will replace the person who are not using AI.
Okay. Sir, one piece of advice, what would you like to give who want to choose a radiology as his dream branch?
One piece of advice also. See, one thing, the clinician sees the patient at the bedside and imagines the lesion.
Yes, sir.
Whereas the radiologist sees the lesion and imagines the patient. So it's a super thing here with the radiologist. Beyond the camera and do everything. It's a doctor's doctor, radiologist, a doctor's doctor. So one thing I can, another thing is that initially for the freshers, initially it takes some little bit time to cope up with the things. So you have to maintain that patience. So once you are acquiring knowledge, once you are able to make the diagnosis, and it's a super easy again. There's no looking back afterwards. And AI not gonna, one thing, AI is not gonna replace radiology. I don't think, because if you're using that AI, it's having a good advantage.
Valuable information as you have exams and sparing for your valuable time for recording this video. And thank you, sir.
Thank you for giving this opportunity. Even it's a good initiative of recording those videos. It will be very helpful to PG aspirants. It's a good initiative.
Thank you. Please like, share and subscribe for more content related videos. Thank you.